still new cases are being reported from Hubei province and Wuhan city, the epicenter of the outbreak. A total of 12,857 confirmed cases and 220 deaths have been reported outside China from 78 countries including Hong Kong, Macau and Taiwan. Among these, 30 countries have reported local transmission also. World Health Organization has declared this outbreak as a public health emergency of international concern on 30th January 2020 and raised the level of global risk to very high on 28th Feb 2020. Though WHO has not declared COVID-19 to be pandemic, it has asked the countries to remain prepared. It is worth highlighting that India initiated required preparedness and action at field level since 17th January itself, much before the advice from World Health Organization. Once a person is exposed to the infection, the disease may develop any time between 1 to 14 days. The main symptoms of novel coronavirus disease are fever, cough, and difficulty in breathing. All suspected or probable cases of COVID-19 must be treated in isolation with barrier nursing and universal precautions to prevent the further spread of disease. In our country, as on 4th March, a total of 29 positive cases have been reported so far. Of these, 3 cases were reported in Kerala earlier, who have since recovered and have been discharged already. Since last 3 days, new travel-related cases have tested positive. These include one in Delhi, having travel history of Italy, and one in Telangana, having travel history from Dubai and contact history from person from Singapore. Both are clinically stable. 6 more cases have been tested positive in Agra, Uttar Pradesh, having contact history with the case in Delhi. Required action as per cluster management plan has been initiated. Further, an Italian tourist and his wife have tested positive in Rajasthan. 14 other accompanying tourists in this group and their Indian bus driver tested positive on their return to Delhi. All of them are reported to be stable. A recent positive case has also been reported in Delhi yesterday, having a travel history from Italy and is stable. The ever-increasing magnitude of this outbreak globally calls for a concerted effort by not only the health department but all sectors of the government. Honorable Prime Minister is personally monitoring the preparedness and response on a regular basis. Government of India has initiated a series of actions to prevent entry of the disease and to contain it. I am daily reviewing the situation. A group of ministers consisting of Minister of External Affairs, Minister of Civil Aviation, Minister of State for Home Affairs, Minister of State for Shipping and Minister of State for Health and Family Welfare, chaired by me, have been constituted to monitor the situation. The group of ministers has met 4 times since its inception on 3rd Feb 2020. Cabinet Secretary is taking regular reviews with all related ministries of Health, Defence, Ministry of External Affairs, Civil Aviation, Home, Textiles, Pharma, Commerce and other officials, including with State Chief Secretaries. My own ministry is constantly reviewing the evolving scenario. Video conferences are being held with states every other day. Government of India has also taken several measures to control the risk of novel coronavirus infection spreading to India. Our first travel advisory was issued on 17th January 2020, and as situation is evolving, the travel advisories are accordingly getting revised. Presently, it prescribes all regular visas / e-visas, including visa on arrival for Japan and South Korea, granted to nationals of Italy, Iran, South Korea, Japan, and issued on or before 3rd of March 2020, and who have not yet entered India, stand suspended with immediate effect. Regular visa/e-visa granted to nationals of People's Republic of China issued on or before 5th of Feb 2020 were suspended earlier. It shall remain in force. Regular visas, e-visas granted to all foreign nationals who have travelled to People's Republic of China, Iran, Italy, South Korea and Japan on or after 1st of Feb 2020 and who have not yet entered India stand suspended with immediate effect. Diplomats, officials of United Nations and other international bodies, OCI card holders and air crew from above countries are exempted from such restriction on entry. However, their screening at point of entry is compulsory. Passengers of all international flights now entering into India from any port are required to furnish duly filled self-declaration form, including personal particulars like phone number and address in India and travel history to health officials and immigration officials at all the ports. Indian citizens are advised to refrain from travel to China, Iran, Republic of Korea, Italy and Japan, and are also advised to avoid all non-essential travel to other COVID-19 affected countries. Screening of passengers was initiated in the country since 18th January 2020. Initially, airports at Delhi, Mumbai, Chennai, Kolkata, Bengaluru, Hyderabad and Kochi were covered, and subsequently it was expanded to a total of 21 airports. As per the evolving situation, initially universal screening was taken up for all passengers coming via direct flights from China, South Korea, Japan, Iran, Italy, Hong Kong, Vietnam, Malaysia, Indonesia, Nepal, Thailand and Singapore. Since yesterday, directions have also been issued for universal screening for all international passengers coming in the country. Signages have been displayed at prominent places in airports and ports. In-flight announcements are being made and self-declaration forms are being filled up by all the passengers. As on 4th March, a total of 6,241 flights have been screened, covering a total of 6,11,167 passengers. Teams of specialist doctors were sent to all the airports to ensure effective screening and arrangement for isolation in the attached hospitals. Screening of passengers has also been initiated in 12 major seaports and 65 minor ports in the country to identify passengers and crew coming from China and to isolate them in case they are found symptomatic. As on 4th March, 16,076 persons have been screened at the ports. Government has initiated screening in all integrated checkposts with bordering countries in collaboration with states of UP, Uttarakhand, West Bengal, Sikkim and Bihar and Seema Shastra Bal and land port authorities. Gram Sabhas have been conducted in villages adjoining the borders to create awareness amongst people about the disease and precautions to be taken in collaboration with the Panchayati Raj Ministry. 8 central teams visiting the bordering villages in states of UP, Uttarakhand, West Bengal, Sikkim and Bihar to review the activities at the border crossings, the conduct of Gram Sabhas and the risk communication to the community have been organized. A total number of 3,823 Gram Sabhas have been conducted and 11,20,529 people have been screened at the border checkposts till now. In view of the continuing lockdown of the Hubei province in China, the Government of India decided to evacuate the Indian students and other professionals working in Wuhan and neighboring cities in the Hubei province. In a coordinated operation with Ministry of Civil Aviation, Air India, Ministry of Health and Family Welfare, 2 special Air India flights were operated between Delhi and Wuhan on 31st January and 1st Feb 2020 that brought back a total of 654 passengers that included 647 Indians, including 2 Indian embassy officials who were on the ground in Wuhan to coordinate the evacuation operation, and 7 Maldivian nationals. These evacuees were kept in Army Quarantine Center at Manesar and ITBP camp at Chawla. All these evacuees were tested after 14 days and on being found negative were discharged on 18th Feb 2020. Further, Indian Air Force on 26th Feb 2020 has evacuated a total of 112 people from Wuhan, which included 76 Indians and nationals from Myanmar, Bangladesh, Maldives, China, South Africa, USA, and Madagascar. The evacuees reached Delhi on 27th Feb morning and are kept at ITBP camp for quarantine for a period of 14 days as per the protocol. I am happy to inform that they have all tested negative so far and are stable. This flight also had carried personal protective equipments, disposables and medical equipments, which was given as a goodwill gesture to China from the Indian government. The Indian embassy and consulates are also in regular contact with the Indian community in other parts of China and is keeping a constant track of their well-being. After another evacuation was successfully carried out by Air India by bringing back 124 people on 27th Feb morning, including 5 foreign nationals who were aboard the COVID-19 infected cruise ship Diamond Princess from port of Yokohama, Japan. They are kept in army facility at Manesar for 14 days quarantine presently. I am happy to highlight that even these evacuees have tested negative and are stable. Regular surveillance has been initiated across the country for all cases having travel history from all major COVID-19 affected countries and for people having contact with such persons and having fever, cough or breathlessness. Through integrated disease surveillance network, all such persons are tracked, and as on 4th March, a total of 28,529 persons were brought under community surveillance and are being regularly monitored throughout the country. The state surveillance officers, district surveillance officers, and the rapid response teams of health professionals under the leadership of state health secretaries are monitoring all such people on a regular daily basis. Sufficient isolation beds have been made available in the tertiary facilities across the country to manage any outbreak. Ministry has also issued guidelines to support states on surveillance and contact tracing, surveillance at points of entry, laboratory samples collection, packaging and transport, clinical management protocols, and infection prevention and control in healthcare facilities. To ensure availability of critical items like personal protective equipments and N95 masks, the exports of the same was also restricted. A buffer stock of personal protective equipments and N95 masks is maintained by the states as well as by the Union government. National Institute of Virology, Pune is the nodal laboratory. As part of ICMR's preparedness for re-emerging infectious disease, NIV Pune has established capacity for molecular diagnosis of COVID-19. Next generation sequencing is also established. Testing of clinical samples has also been initiated in 15 laboratories. Another 19 laboratories are being prepared to test samples to ensure adequate geographical spread across the country. The network is being further expanded. Risk communication material has been prepared and is widely disseminated even in regional languages through the states. Required awareness in communities ensured through technical briefings by experts in radio and television. Daily press briefing is being held by the Ministry of Health and information is being shared through social media. A 24/7 control room is operational with call center number 011-2397-8046. So far, more than 9,200 calls have been attended, including 667 international calls. The Government of India is in regular touch with the World Health Organization headquarters, regional office and country office to get updates on the evolving scenario. Our focus is on adherence to core capacities for disease preparedness and response, which include surveillance, laboratory diagnosis, hospital preparedness, logistics management, capacity building of healthcare staff, and risk communication to the community. The scale and extent of our interventions have increased in alignment with the evolving situation of COVID-19 across the world and India in particular. With the increasing global spread of the disease, we are confronted with new challenges. The contact tracing of positive cases requires tracing of hundreds of contacts in multiple locations and monitoring their health. Similarly, the cases in Agra being transmitted to family members by the confirmed case has necessitated putting up a containment plan to contain the clusters of cases in Agra. Another major area of concern is Indian pilgrims and students stranded in Tehran and Iran, epicenters of the Iran COVID-19 outbreak. Government of India is following up with Iran authorities for their well-being and to tie up evacuation as per the need. In addition to manage travel-related cases, additional challenge is to contain clusters due to local transmission that requires highly resource-intensive containment operations. We have provided the containment action plan to all the states. A national level training workshop has been planned for all the states and hospitals from other ministries on COVID-19 management on 6th of March 2020, which will then be taken up to the district level. Senior officers of the ministry have been deputed to states and UTs to review their preparedness and provide required guidance in the containment efforts. We have designated district collector as the nodal officer at the field level for containment operations. States have been guided in terms of identifying containment zone, buffer zone, and preparation of micro plan to ensure effective, active, and passive surveillance and contact tracing through interdisciplinary teams in the areas where cases are located. I want to inform this House that the government is taking all necessary measures to prevent the spread of the COVID-19 in India. I seek the cooperation of all the members of the House in creating awareness about the disease and informing the countrymen about the various preventive steps that they need to take. Thank you.
काफी विस्तृत वक्तव्य दिया है माननीय मंत्री जी ने। एक सेकंड नहीं अभी बात पूरी तो बात अजीत जी बात तो पूरी होने दीजिए। अभी मैंने मना कहाँ किया अभी एक सेकंड अखिलेश जी बालूदा प्लीज सिट डाउन आई एम जस्ट अलाउइंग। माननीय मंत्री जी के वक्तव्य के पश्चात सामान्य अजीत जी सुनिए तो सही, मुझसे बेहतर आप नियमों को जानते हैं। उसके अंदर चर्चा की अनुमति नहीं होती है, परंतु विशेष मसला है, विशेष महत्व का मसला है, इसलिए कुछ माननीय सदस्यों को सुझाव के रूप में अपनी बात कहने का कि मैं अनुमति दे रहा हूं। बात संक्षेप में रखिए, 1 मिनट में मैक्सिमम 2 मिनट में बात रखिए। इतना प्लीज no reply, no response will be from the honorable minister. Only you can put your suggestions or queries what you want. जी प्लीज अजीत जी।
सर स्पीकर साहब हम लोगों को कहा
ओके
कि भाई आप चर्चा में भाग ले सकते हैं, इसीलिए भाग ले रहे हैं।
करिए
सदन में ये तरीका ये प्रैक्टिस नहीं है, मैं जानता हूँ।
आप बोलिए ना,
राज्यसभा में है, लोकसभा में नहीं है, फिर भी बोलने दीजिए।
आप हमें सुझाव दीजिए, बोलिए।
सर बात यह है कि मार्च सीओबी 7 सीओबी के साथ हम परिचित है। ये नया आ गया कोविड-19 और ये हमारे लिए नई एक समस्या पैदा कर रहे हैं। ये जूनोटिक है बाय नेचर और इसमें हिंदुस्तान के लोग परिचित नहीं है। तो जहां जहां कोरोना वायरस की बात उठते हैं वहां हरकंप मच जाते हैं। तो सबसे पहले आपको ये देखना चाहिए कि ये कोरोना वायरस को लेकर किसी हालत में अफवाह फैला ना जाए। सर अफवाह के चलते बड़ा हानि होने की संभावना है। दूसरी बात सर, आप प्रिएम्प्टिव मेजर की बात करते हैं, प्रिएम्प्टिव मेजर सबसे बड़ा मेजर हमें लेना चाहिए, क्योंकि सर अभी भी वो मास्क बाजार से गायब होने लगे हैं। दवा पैरासीटामॉल उसको भी आपको अच्छा जमा बड़ा करना पड़ेगा। और सर सबसे बड़ी रेस्पिरेटरी हाइजीन, आम लोगों की इसमें कोई जानकारी नहीं होते। टीवी देखते हैं, टीवी में कहते हैं कि आप सैनिटाइजर यूज करो, साबुन और पानी यूज करो हर वक्त हाथ धोने के लिए। हिंदुस्तान के लोग इसमें आदी नहीं है। सैनिटाइजर कितने लोगों के पास है मुझे जानकारी नहीं है, खासकर मेरे पास तो नहीं रहते। तो साबुन, पानी, सैनिटाइजर ये गांव में मुहैया कराने के लिए आपको तो कुछ कार्रवाई करना पड़ेगा। आप बाहर से जब एयरपोर्ट पे स्क्रीनिंग करते हैं, लेकिन हमारे हिंदुस्तान पूरा बॉर्डर है, चाहे लैंड बॉर्डर पूरा होते हैं, तो इसमें गांव में पंचायत को जो आप नियोजित करते हैं, डिप्लॉय करते हैं, ये अच्छा है। लेकिन पंचायत में इस तरीके की सुविधा मुहैया कराने के लिए आप क्या कर रहे हैं? और साथ साथ मैं ये सलाह दूंगा कि ये वायरोलॉजी टेस्ट की जो बात आप कर रहे हैं, ये हर डिस्ट्रिक्ट में होना चाहिए। इसका सुविधा हर डिस्ट्रिक्ट में होना चाहिए। और एक हेल्पलाइन भी आप तैयार कीजिए। सर ये कोरोना वायरस की जो नोवेल कोरोना वायरस हमारे लिए एलियन एक डिजीज आ गए हैं। सर दुनिया में 60 कंट्री में ये फैला रहे हैं। तो सर सबसे पहले बात यह है कि हमारे हिंदुस्तान में ये 130-32 करोड़ आबादी की देश है। यहाँ गांव में, दूर दराज गांव में लोगों को कैसे पता चलेगा? और सबसे बड़ा बच्चे को सुपरविजन करना बड़ा जरूरी होता है। हमारे जो उम्र हो गए, हम लोग तो सब जानकारी ले लेते हैं, लेकिन बच्चे लोगों को जो सिम्टम वो देखने के लिए, वो समझने के लिए आपको तरह से मैसिव और इंटेंसिव कैंपेन होना चाहिए। क्योंकि बस स्टैंड है, रेलवे स्टेशन है, भालना एरिया क्या कहा है, ये आपको आइडेंटिफाई करना चाहिए। और भालना एरिया है, मैसिव और इंटेंसिव कैंपेनिंग होना चाहिए। खासकर बच्चे लोगों के ऊपर ज्यादा ध्यान देने की जरूरत है। सबसे बड़ा दवाई, मास्क और जो सैनिटेशन और रेस्पिरेटरी हाइजीन, इसके विषय पे आप भाई सर पूरा कैंपेन होना चाहिए, जागरूकता होना चाहिए। और हमारे नेता राहुल गांधी जी पहले ही सरकार को सतर्क कर चुके थे। इस तरीके की हालात पैदा हो रहे हैं।
प्लीज कमी मुझे just 1 minute please try to be brief। 1 minute okay
sir,
please no
sir, in the minister in his statement
बैठिए
the minister in his statement has clearly told us that they have been warned in January and they've taken a lot of steps. I congratulate him for that, but he's also mentioned that there's only one virology institute in Pune, and I think it is not sufficient because it is a global epidemic. It's threatening the international scenario, and we should have this institute at least in zones, in different zones of the country, and I think they had adequate time to establish that, and they should have done that. And one more thing I'd like to say is that the management, hospital management, it is within the cities. That the quarantining the patients is within the city hospitals, and that actually he's very clearly aware that this is the most transmissible disease compared to MERS or SARS. This is much more transmissible, and taking the patients inside the city and quarantining them inside hospitals is not a right thing. I think you should have the medical facilities closer to the airports where they can be screened and the hospital management can be done. And the screening, I think thermal screening is not available in most of the airports. It is not there at all, because I've gone to the airport to receive people who've come from abroad, and thermal screening was not done there. I think that has to be done, and the following tests also, the swab tests also not being conducted. Rather than having thermal screening, they're asking the people who are coming back from foreign countries to reveal where all they've traveled on their own. I think that will not be sufficient, and I also think that the masks are not available. There is a panic among the people all over the country that masks and medication is not available enough.
श्री
Thank you, sir.
सौगत राय जी।
Sir, it's good that the House, after a 4-day hiatus, has gathered in peace to discuss the serious matter affecting the health of the people. COVID-19 or the coronavirus disease is a new disease. We had earlier the Ebola virus problem. But this coronavirus, which has originated from Wuhan in China and is now mainly spread to Iran, Italy, South
सौगत बाबू
Korea.
सुझाव दीजिए। हिस्ट्री की जरूरत
सुझाव
नहीं
में आ
है।
रहा हूँ।
प्लीज।
आप तो सर इतना इम्पेशेंट नहीं थे पहले।
नहीं, मैं अभी भी नहीं हूँ।
मैं जानता हूँ। अब क्यों धीरज खो रहे हैं? अच्छा हो रहा है, हाउस शांत से चर्चा कर रहा है, इसमें आप टिप्पणी कृपया मत करिए। मैं शॉर्ट में खत्म करूँगा। Sir, viruses are something which are very small, cannot be seen with naked eye. ये क्या हो रहा है?
जरा बोलिए, आप बोलिए।
सर, हम तो बोलने चाहते हैं। Sir, viruses cannot be seen under microscope. Only under electron microscope they can be diagnosed. So there is no cure to any viral disease. You can do only symptomatic treatment, and one can only try to contain the disease, avoid physical contact, don't shake hands, keep a 3 feet distance, cover your eyes, mouth and nostrils. So these are things which have to be communicated to the people. I suggest to the minister that in every TV channel and radio there should be 15-second clips to advise the people not to panic. There is a great panic throughout the country. So far only 29 people out of 130 crore people of the country have been positively diagnosed. So disease compared to other countries is still under control. Government of India has taken certain steps, especially with regard to airports and the land ports. But as Adhir mentioned, ours is a long and porous border, and China or Wuhan is rather close to us. Sir, हो गया।
देखिए, मैं एक मिनट सौगत बाबू, सर, मैं मान्य सदस्यों से एक अनुरोध दोबारा कर रहा हूं। ये चर्चा नहीं हो रही है। ऑनरेबल मिनिस्टर ने स्टेटमेंट दिया, कोई सुझाव आपको दे रहे हैं। प्लीज बी पॉइंटेड, बी ब्रीफ, दैट्स ऑल।
हमारा सुलझाव खत्म हो गया सर। कोरोना वायरस में फीवर होता है, काफ होता है, काफ से ड्रॉपलेट निकलता है। सो you have to advise people not to shake hands, keep a 3 feet distance, not to step on the droplets. Sir, the other thing is the states.
माननीय चेयरमैन सर, माननीय मंत्री जी ने जो विस्तृत रूप में स्टेटमेंट दी उसके लिए मैं उनका अभिनंदन करता हूँ। बहुत ही डिटेल में उन्होंने बताया। उसमें समाधान की बात यह है कि 28 ही है, अभी तक कोई डर नहीं लग रहा है। फिर भी ये डर पैदा हुआ है दोनों तरफ से। मैं एक ही रिक्वेस्ट करने के लिए यहाँ खड़ा हूँ, खास करके हमारे भारतीय जो प्रदेश में अटके हुए हैं, उनके परिवार पैनिक है। यहाँ उनकी स्थिति क्या है नहीं समझ में आती है। जैसे ईरान में बहुत है, एक मुझे लगता है 1000 से भी ज्यादा लोग ईरान में लटके हुए हैं। तो उनके बारे में सरकार उन्हें देश में लाने के लिए क्या कर रही, कदम उठा रही है, वो जानकारी वो परिवार भी चाहता है, वो भी लोग चाहते हैं। आपने उसने स्टेटमेंट में कहा कि ईरान में हमने बात की है उनके तरफ ध्यान देने के लिए, लेकिन कब वापस आएंगे इसकी चिंता बहुत लोगों को है। उसमें सरकार क्या कदम उठा रही है वो एक मेरी विनती है। और वायरोलॉजी के लिए भी जो करीमोजी ने कहा वो बहुत इंपॉर्टेंट है। वो एक ही इंस्टीट्यूट है पुणे में, वो देश में और कई जोनल करेंगे तो और अच्छा होगा। बस धन्यवाद।
ठीक है, श्री रघुराम कृष्ण राजू। जी
Thank you, Speaker sir, for giving me an opportunity to talk on this important subject which is shaking the whole world. And in this regard, of course, majority of the things were already clearly explained by our Honorable Minister. But what I would like to submit here is our Hindu tradition where don't shake hands, do namaste, and like this, all this traditional Hindu culture, this will, if this is demonstrated clearly, and this has to be demonstrated. Adab also, Adab, this thing. So these are all very good habits we have. Indian culture.
Okay.
Indian culture, this has to be clearly demonstrated, and let there be advertisements as suggested. Let there be advertisements that the mortality.
माननीय सभापति महोदय, अभी माननीय मंत्री जी का विस्तार से कोरोना वायरस पर जो उन्होंने अपनी बात को रखा है, आज पूरा देश चिंतित है और मंत्री जी को मैं बधाई देता हूं कि बड़ा विस्तार से उन्होंने हर बात को रखा है। पूरा देश इससे चिंतित है, लोगों में भय व्याप्त है। एक बार मेरा एक भी सुझाव होगा कि पंचायत स्तर से लेकर जिला स्तर पर कोई न कोई इसका समाधान हो कि जहां भी पता चले उसको तुरंत पकड़ने का प्रयास किया जाए। और हमारे देश के प्रधानमंत्री भी चिंतित हैं। माननीय मंत्री जी को मैं बधाई देता हूं और धन्यवाद देता हूं कि अन्य देशों से पहले हमारे मंत्री जी आज चिंतित हैं। बहुत बहुत धन्यवाद।
मंत्री मेहता साहब,
सर हो गया। Chairman sir, we got a very exhaustive statement from Honorable Health Minister relating to the preparedness of our country and also what is happening outside. For last 2 or 3 decades, virus has become more pandemic, and the earlier diseases that were actually affecting the human race has subsided to a very great extent because of the exploration that has been made through medical science. Number of viruses has affected our country, and Indian scientists were also praised throughout the world when Ebola affected large parts of Africa. So today, I would like to impress upon the government, and also they should disseminate that information. The exploration our medical scientists are making to mutate the virus which has caused this terrible disease throughout the country. We are told that by month of May, adequate medicine will be tested and also be experimented, tested, and also be out in the market. But the panic that has been created throughout the world, also in our country, is that is this virus only confined to the winter season? If it is going to have the similar or same effect also in summer, there will be no end to it. What has been also stated is this virus affects in a major way to those people who are above 60. The children are seldom affected. Children are also affected. but it is very minuscule. It is very minuscule. When you have a professor sitting next to you, you have a lot of suggestions also coming. But it should go to the government. But here I would like to also mention, sir, screening of international passengers in airport is a necessity. We have a screening facility also in Delhi, but all airports which have international flights, including Bhubaneswar, should have screening facility and also quarantine facility. When I traveled to Africa, that time I was quarantined before I went to take a medicine, take an injection, and also was quarantined near the Delhi airport. And for yellow fever. Now again you have that one. But my suggestion is quarantine, as has been suggested by honourable member from DMK, madam, that quarantine system should not be done in a medical college or medical facility that is available today, where large number of patients go, large number of people go. It should be excluded, as it was done in Haryana when students or people, Indians, came from China, Wuhan. Therefore, my earnest request is, you also take the state government along with you. Give them advisory and also provide certain amount of funding so that they can also help in eradicating this disease.
धन्यवाद अधिष्ठाता महोदय। कोविड-19 का जो प्रकोप हमारे देश में फैल रहा है, ये अत्यंत ही दुखद है, लेकिन सरकार इसको संज्ञान में लेकर के आज संसद में इस पर विस्तार से अपना वक्तव्य दिया है। इसके लिए मैं धन्यवाद देता हूं। मान्यवर, मेरे 2-3 सुझाव हैं। मेरा अनुरोध रहेगा कि सरकार इनको गंभीरता से ले। अभी मास्क की बात हुई थी, ये भी बताया जा रहा था कि सरकार ने उसका एक्सपोर्ट रोक दिया है, लेकिन उसकी प्राइसिंग, जो उसके दाम है, वो ये कंपनियां अपने आप बढ़ाती चली जा रही हैं। जो 15 रुपए का मास्क मिलता था, आज वो 500 रुपए का मिल रहा है। उसके साथ साथ ये जो हैंड सैनिटाइजर की बात हो रही है और साबुन, इन सब चीजों की बात हो रही है, इनके भी दामों के ऊपर अच्छी निगाह रखी जाए। हैंड सैनिटाइजर जो 50 या 150 रुपए में मिलता था, आज वो 500 रुपए का मिल रहा है। यहां पे कुछ कंपनियां इकोनॉमिक अपॉर्चुनिटी देख करके इस प्रकोप का फायदा उठा करके अपनी जेबें गर्म करना चाहती हैं। मेरा सरकार से अनुरोध है कि इसके ऊपर खासा निगाह रखी जाए, क्योंकि जो इस देश के सबसे गरीब लोग हैं, उनमें अगर ये फैलता है तो बहुत तेजी से फैलेगा और उनको ये सुविधाएं देना जरूरी है। खास तौर से उत्तर प्रदेश में एक और सुझाव है मेरा। उत्तर प्रदेश में 6 लोग इससे ग्रसित हुए हैं। मेरा निवेदन है कि उत्तर प्रदेश लखनऊ एयरपोर्ट पे, वहां पे भी ये थर्मल स्क्रीनिंग लगाई जाए और वहां पे भी ये वायरोलॉजी का सेंटर खोला जाए और हर एक मेडिकल कॉलेज में ये सेंटर होना चाहिए। मेरा यही धन्यवाद।
कृपया संक्षिप्त, प्लीज आई रिक्वेस्ट अगेन एंड अगेन।
थैंक यू चेयरमैन। चेयरमैन साहब, अभी तक ऑनरेबल मिनिस्टर ने काफी डिटेल के साथ सेंट्रल गवर्नमेंट ने क्या क्या एक्शन लिया है, किस तरह से मॉनिटरिंग कर रहा है, बहुत अच्छे तरह से जो है ना पूरा हाउस को बताया, हाउस का थ्रू पूरा देश को बता दिया। पहले उसको ऑनरेबल मिनिस्टर को धन्यवाद करना चाहता है। उसका साथ साथ जो है ना चेयरमैन साहब, आज ही हमारा जो है वायरस के बारे में क्वेश्चन था, उसमें तो एक्सटर्नल मिनिस्टर ने उसका रिप्लाई दिया है। वो एक्सटर्नल मिनिस्टर का रिप्लाई को जो ऑनरेबल मिनिस्टर का जो भी ब्रीफ किया, उसमें कुछ डिफरेंस है। ऑलरेडी जो अफेक्टेड पीपल जापान में, यूए में ऑलरेडी अफेक्टेड पीपल है। वो अफेक्टेड पीपल अभी तक जो है इंडिया में लेके नहीं आया। अफेक्टेड पीपल का पोजीशन क्या है उसको थोड़ा बता दे। उसका साथ साथ जो है ना हमारा जो है वैल्यूबल 3-4 सजेशंस है। हम तो यही बोलना चाहता है, आपका जो है ना सर, आपका ब्रीफिंग में आप बताया था स्पेशल इक्विपमेंट एंड क्रिटिकल इक्विपमेंट का जो है ना हम लोग का रिक्वायरमेंट है। हम तो जो है ना ऑनरेबल मिनिस्टर को, ऑनरेबल सेंट्रल गवर्नमेंट को हम ये बोलना चाहते हैं, सब स्टेट्स के लिए जो क्रिटिकल इक्विपमेंट एंड स्पेशल इक्विपमेंट को इमीडिएटली लेकर सबको देना चाहिए। उसका साथ साथ जो है ना अभी स्टेट्स के लिए ये वायरस का बारे में, ये कोरोना वायरस का बारे में स्पेशल फंड्स रिलीज करना चाहिए। अभी ऑलरेडी जो है ना वर्ल्ड बैंक ने 12 बिलियन जो है ना अमाउंट रिलीज कर रहा है, इसके लिए बोल के मीडिया का द्वारा देखा है। उसी तरह से सेंट्रल गवर्नमेंट भी ये पर्टिकुलर जो है ना वायरस के लिए इसको जो है इमीडिएटली फंड्स रिलीज करना चाहिए। उसके साथ साथ जो है ना ऑनरेबल मेंबर कनमोली जी ने बहुत अच्छा पॉइंट बताया। हमारा जो तेलंगाना में भी जो ना काफी नाइट एंड डे हमारा चीफ मिनिस्टर जो है इसको इसके बारे में जो ना कंट्रोल, उसका जो भी इफेक्टेड, अभी जो इफेक्ट है, एक आदमी इफेक्ट हुआ बोल के बताया था, हम लोग जो है उसको कंट्रोल रूम्स लगा के काफी कुछ कर रहा है। इसमें हमारा और एक सजेशन टू ऑनरेबल मिनिस्टर साहब, आप जो है ना जो कलेक्टर को लगाया, डॉक्टर्स का जो है ना, डॉक्टर्स के कमिटी को, एक्सपर्ट डॉक्टर्स के कमिटी को लगा दीजिए। उसका वजह से
अखिलेश जी, और कोई सुझाव आ गया है तो रिपीट करने की आवश्यकता नहीं है। जी
सभापति जी, मैं आपका धन्यवाद देता हूं, मुझे अपनी बात रखने का मौका मिला है। मैं माननीय सभी सदस्यों को से अपने आप को जोड़ता हुआ, और माननीय मंत्री जी ने बहुत तैयारी की है। मैं आपके माध्यम से सरकार से यही कहूंगा, सरकार प्रचार करने में बहुत आगे है। ये गंभीर बीमारी है, सुन लो, आपके ही काम का है। सभापति महोदय, ये दुनिया के बाद भारत में आई बीमारी, और हम तो उत्तर प्रदेश के हैं, आगरा से फैल गई। सभापति महोदय, मैं सरकार से निवेदन करूंगा कि इस बीमारी का प्रचार इतना करें कि लोगों तक बात पहुंच जाए और इसको रोका जा सके।
जी,
यहाँ से और आपकी तरफ से, हमारी तरफ से ऐसा कुछ न जाए जिससे लोग और डरने लगे। वैसे भी सरकार बहुत डराती है, और सरकार की तरफ से अगर ऐसी भावना जाएगी। सभापति महोदय, और मैं तो ये कहूंगा, सभापति मंत्री जी जो तैयारी बता रहे हैं, जो कई तैयारी उन्होंने बताई हैं, जो हालात अभी स्वास्थ्य विभागों की है,
सुझाव दीजिए अखिलेश जी, सुझाव दीजिए ना कुछ
उत्तर प्रदेश की। मैं चाहूंगा कि सरकार इसके लिए अलग से व्यवस्था करे, क्योंकि अगर निगरानी नहीं की जाएगी तो ये बीमारी कंट्रोल में नहीं आएगी। अभी तो हवाई जहाज से आई है,
श्रीमती
होंगे, स्क्रीनिंग के लिए व्यवस्था नहीं है, और ये बीमारी अगर ट्रेन से चल दी, गरीबों के बीच में पहुंच गई, तो कितने लोगों की जान चली जाएगी। बहुत बहुत धन्यवाद।
Thank you, sir. I thank the Honourable Minister for his absolute detailed replies also. I would like to put it on record for my state. I'm grateful to the Honourable External Affairs Minister. He's been very cooperative, Shri Jaishankar ji. I'd like to thank him on behalf of my state. Because whenever we've reached out to him to help some people from Iran who need to come. There are two very small points I'd like to ask the Honourable Minister. That in your budget for the Health Mantralaya, the monies which are put for epidemics is very abysmal. So could you increase that, because I think all the states, including mine, need support. There are gaps with medication availability. So is this the time you could help the states? Second, there is a lot of doctors we hear on various channels, and there are articles written. You have taken 4 meetings, which is absolutely much appreciated by us. But could you do a daily briefing to the media so that there is only one story that goes with every channel has some doctor saying, now we don't know who to believe and who not to believe. So could you take one guideline and speak regularly so we all speak in one voice and follow what the government gives us? Thank you, sir.
Shri Hasnain Masoodi ji.
Honorable Chairperson, sir, through you I would invite attention to Honorable Minister to 350 students from Kashmir stranded in Iran. I have taken the matter with the External Affairs Minister. I have met him twice, but nothing is being done. Just a passing reference in the statement made by the Honorable Minister. There are 1,000 pilgrims from Kargil and 350. The students now are confined in hostels, and they don't have access to the eatables. And their plight is, governments appears to be unmindful of the plight and no urgency at all. Why should Kashmir be at a receiving end in every sector? Be it political aspirations, be it good governance, or be it the students who are standing in Iran. Now, sir, having regard to spread and sweep of the disease, Iran is the next after China. Government, it should have attracted attention of the government at the first instance. They should have taken steps during the last 10 days to evacuate and get back the students. And in the clarification, I expect a statement from the Honourable Minister that your time frame will be got back.
Please be brief again. Ji.
Thank you, sir. Sir, thank you for giving me the opportunity to speak on this very important subject. Many of the members have already spoken about the health issues that are arising out of this. What I wanted to make a point of is that the most important thing is personal hygiene and habits. And for this, I think that the awareness that needs to be taken across the country is very important. But also, equally importantly, we're in the budget session, sir, and we need to understand what is going to be the economic impact of this virus, because people are expecting a global economic impact. Some people are saying that there could be a global GDP growth slowdown of even 1 to 2%. And if that happens, India is not going to be exempt from that. And when we're already looking at our GDP growth going below 5%, because of this virus, will it go to 3%? And if it goes to 3%, what will happen to our economy? This is a budget session, sir, and I think some focus needs to be also put on what is the economic impact of this virus on our country, sir. Thank you.
Shrimati Navneet Rana, please, quick points.
मुझे लगता है मंत्री जी ने बहुत डिटेल से समझाया है और जिस तरीके से बाकी सदस्यों ने भी बताया है कि टीवी पे अलग अलग प्रचार चल रहा है, कोई बोल रहा है 30 डिग्री होगा, कोरोना वायरस खत्म होगा या कैसे होगा। मैं बताना चाहूंगी कि कई कल से फोन आ रहे हैं जो बाहर विदेश से लोग यहाँ पे ट्रैवल कर रहे हैं, उन्हें तो हम रोक रहे हैं, पर जो टूर एंड ट्रैवल से जिन्होंने अपनी अपनी ट्रिप्स बुक की हैं उनके फोन आ रहे हैं कि अगर हमें ये पोस्टपोन करना है तो टूर ट्रैवल्स को अगर वो लेटर दे रहे हैं कि हमें अपनी ट्रिप्स पोस्टपोन करनी है, हमें विदेश में जाना नहीं है, तो उसके लिए मैं विदेश मंत्री से और हेल्थ मिनिस्ट्री से भी रिक्वेस्ट करूंगी कि उनके टूर ट्रैवल्स कैंसिल ना करते हुए ना उनका नुकसान हो ना ट्रैवल करने वालों का नुकसान हो, उनके लिए कुछ सोचा जाए। और ऐसे विदेश मंत्री ने एक अनाउंसमेंट करनी चाहिए, जब तक विदेश मंत्री ये ना सूचित की जाए कि अब कोई भी चिंता करने जैसी बात नहीं है पूरे वर्ल्ड में, आप ट्रैवल कर सकते हो। हमारे हेल्थ मिनिस्ट्री ने कहा है कि पिछले 4-5 दिनों से 2 स्कूल नोएडा के शट किए हुए हैं, उसका कारण बताना चाहिए और बहुत सारी चीजें हैं जिस तरीके से इन्होंने बताया है।
I would like to point out the experience of Kerala. As far as Kerala concerned, there are 3 persons were affected corona. No, the reporter from they were coming from China, and reported 3 cases. All the 3 cases were treated very well. They were discharged from the hospital. It is well appreciated by the WHO and the central government. I request the central government to seek the experience of Kerala and follow the methods everywhere in India.
Shri E.T. Mohammed Bashir sir.
Honorable Minister, in his statement have explained in details the preparedness we have made to meet the threat of coronavirus. That's good. As correctly pointed out by my former honorable members, I also emphasize the need for improving the testing facilities in the airport itself, and that should be developed. Similarly, awareness creation is also very important in this. Government should give emphasis for that also. Thank you.
Thank you. Shri N.K. Premchandran ji.
Thank you very much, sir. Sir, I am having 3 suggestions. So, number 1 is regarding the test of coronavirus. Sir, there are 2 ways to detect a virus: through the genetic material DNA or RNA, or to detect the protein of the virus. The rapid test looks at the protein. But it is quite unfortunate to note that just now Kanimudi ji has stated we are having only one institute to check the virus, that is National Institute of Virology. Sir, we are having a virology institute in the state of Kerala in Alleppey. That has to be strengthened, that has to be empowered. The problem now is I am getting so many telephone calls from the people from Kuwait. Those who have come from Kuwait, they are not able to go back because they have to submit a certificate that there is this coronavirus infection is not there. Such a certificate has to be produced. So I seek the intervention of the External Affairs Ministry so as to resolve that problem also. That is number 1 point. And number 2, yes, I'm only sticking to the point, sir. So number 2, just Arif and E.T. Mohammed Bashir has stated, in Kerala we have confirmed 3 cases and there are 2,400 suspected cases. How it is managed, I want to share the experience with the Honorable Minister. The 2,400 cases, suspected cases were isolated in their respective homes, not in public place. Sir, please. So decentralized management is required with the help of the local bodies. That is the second point which I would like to know. So that is, there is no treatment as far as this case is concerned. Only management is there. So proper management at the decentralized level. So with the help of the local bodies. So local bodies has to be taken into confidence so as to address this issue. And also you provide assistance to the Grama Panchayat and the local bodies also with these suggestions. I conclude. Thank you very much, sir.
Shri Hanuman Beniwal ji.
सर, सभापति महोदय, सबसे पहले तो कोरोना वायरस जिसकी वजह से पूरे देश के अंदर खौफ है, मैं धन्यवाद दूंगा स्वास्थ्य मंत्री जी का, जिन्होंने इतने जल्दी इस कोरोना वायरस जो पूरे विश्व के अंदर लोग इतने डर गए कि कोरोना कोरोना कोरोना, और हिंदुस्तान के अंदर ऐसा लग रहा था कि इससे बड़ा नुकसान होगा, लेकिन मंत्री जी ने और हमारी सरकार ने इस पर नियंत्रण पा लिया। सभापति महोदय, एक मिनट में मेरी बात समाप्त करूंगा। कोरोना वायरस के जो 29 मरीज है, ज्यादातर इटली से आए कोरोना वायरस के मरीज। तो मेरा सभापति महोदय इसके अंदर एक ही कहना था, अधिर रंजन जी भी बोला था कि सबसे पहले राहुल जी ने पूछा तो कहीं ये सारा इनके घर से सोनिया गांधी जी इनकी भी जांच कराओ पूरे परिवार
नो नो नो, ये कार्रवाई में नहीं,
सोनिया गांधी
कार्रवाई निकालिए इसको।
राहुल
नो 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 नो,
प्रियंका गांधी
नो नो हनुमान जी,
इनकी भी आप जांच कराएं कि कहीं ये तो कोरोना से पीड़ित नहीं है ये लोग।
क्या कर रहे हैं आप?
और मैं
क्या कर रहे हो? बता रहे हो? नो नो नो, क्या है? व्हाट इज दिस? नो नो, की कार्रवाई 2 बजे तक के लिए स्थगित की जाती है।